Well, thank you all, first of all, for joining us tonight, and welcome to YIMBY Action's Conversation Connecting Housing and Health. My name is Amna, and I'm a University of Michigan School of Public Health graduate who studied the social determinants of health, including housing and policy solutions that can help solve health equity issues. I'm currently working at the Stanford Prevention Research Center at the Stanford University School of Medicine on projects that evaluate the equity and effectiveness of tobacco control policies in California and across the country. I've been volunteering with YIMBY Action for a few months now, specifically providing a public health lens to the housing space. I'll be moderating the discussion today, and I'm joined by my colleague, Jacqueline, who will be helping out with Q&A. Jacqueline, do you want to introduce yourself?
Sure. Hi, everyone. My name is Jacqueline Martin. I am also a University of Michigan public health graduate, which is where I met Anna. I currently work out of the University of Chicago on a project working to reduce healthcare disparities within health systems. Very excited for tonight's chat.
For those of you who are new to YIMBY, YIMBY Action is a network of pro-housing activists fighting for more inclusive housing policies. We drive policy change to increase the supply of housing at all levels and bring down the cost of living in opportunity-rich cities and towns. We're really excited for the opportunity to have this discussion tonight on housing solutions for health justice. Because of COVID-19, health has really been in the forefront of all of our minds, especially how health is connected with every aspect of our lives, from our jobs to school to how important our homes are in keeping us healthy. I think now more than ever, we need to think about how different sectors are impacting one another and where we can possibly align efforts to have a greater impact. Today, we have 3 guests, each with a unique perspective on housing's impact on our health. We have Kiana Bess, who is a doctoral student at the University of Michigan, also Department of Health Behavior and Health Education at the School of Public Health. Her research really focuses on examining the structural and social determinant of health pathways, such as housing, that influence child and adolescent health outcomes. We also have Anthony Nardone, who is a medical student in the UC Berkeley-UCSF Joint Medical Program. His research has focused on social determinants of health, environmental health, and health equity. He recently examined the associations between historical redlining and health outcomes today. And lastly, we have Angela Jenkins, who's been an innovative leader at Kaiser Permanente for nearly 20 years, both in the East Bay service area and Northern California regional offices. Angela is currently the Senior Director of Community Health for Kaiser Permanente's Northern California region, leading a portfolio of initiatives that address equity, social justice, healthy school climate, mental health and trauma, community and family safety, homelessness prevention, and health and nutrition. In addition, she provides oversight for Kaiser Permanente's award-winning educational theater troupe, a health education program that reaches out to more than 165,000 youth annually. So today we'll walk through the different ways that we see housing impact our health today and how policies created to keep our communities racially and economically segregated contribute to health disparities. If any of you have been watching YIMBY Action's latest series on making urbanism anti-racist, this conversation will start connecting those discussions to the health and healthcare sector. Lastly, we'll discuss some ways that housing and health sector can work together. During this discussion, please feel free to submit questions for the panelists. We're hoping to set aside some time at the end for a brief Q&A. So let's go ahead and jump into things. To get us started, can each of you talk a little bit about how you ended up in the housing and health space, kind of your journey into this area? Kiana, did you want to get us started?
Sure. So good evening, everyone. As Amna stated, I am a doctoral student here at UMich, and I ended up in the house and health space by way of my interest in examining neighborhood influences, particularly the built environment, on health outcomes. And so last summer, I was able to join my advisor, Dr. Rashanik Metapanya's Community Participatory Based Research Project. And it's a partnership with Fair Housing Center of Metropolitan Detroit and the Healthy Environmental Partnership. And it's to examine what we did was to examine the predictors of housing discrimination in the Detroit metropolitan area. So this project really introduced me to the many dimensions of housing, particularly the importance of access and affordability, and how the decision on where people decide to live is not always autonomous. And that can lead definitely to housing insecurity and instability. So to sum it up, what I'm doing is kind of combining my interest in children and adolescent health outcomes and housing, and examining those pathways into which they connect.
Great, thank you. Angela, did you want to share?
Sure. Hi. Yeah, how I got into housing and health. I think 2 years ago when our CEO, Bernard Tyson, was still leading our company, all of us collectively at Kaiser in downtown Oakland were watching the homelessness problem explode in the community. And given the way in we approach our community health work in terms of looking at social determinants and factors that contribute to one's long-term health outcomes, it was obvious to us that we needed to do something about the homelessness crisis, which also made us think about what we could do around housing affordability. And so at that time, I returned back to the region to do this work and was handed a portfolio of work that included dealing with helping us develop our regional strategy around homelessness and housing. And I had not done homelessness and housing work before, so it was new for me. But some of the work that we had done earlier around healthy eating, active living made us realize that place mattered when it means to people's health in terms of the conditions in the community in which you live contribute to your long-term health outcomes. We know that when we look at the zip code data, and people are dying at higher rates in certain communities. So homelessness, addressing that was a natural next step for us, and our CEO was really interested and passionate about us addressing that. And so I was able to help with our national office develop our regional strategy around homelessness and housing, linking it to health, and also leading an interesting effort where we were able to house 500 frail seniors within a year, working with a community-based organization. So learned a lot around housing, the policies, the systems that either help or don't help people have gain access to and maintain their long-term affordable housing. So that's how I kind of just slipped into the work and have become very passionate about it along the way.
That's great to hear. And Anthony?
Hi, good evening, everyone. It's a pleasure to be here and an honor to share the panel with both of you. My name is Anthony Nardone again. I'm a fourth-year student in the UCSF UC Berkeley Joint Medical Program, which is a 5-year joint MD-MS program. And I spend most of my time currently as a medical student. You'll see I'm in scrubs right now. It's because I just came from the hospital at Kaiser Permanente, actually. And I spend most of my time currently seeing patients in the clinic and the hospital, but have spent a good amount of time over the past few years doing research as of late, which has been focused on the intersection between historical redlining and current health outcomes. I guess broadly, what led me to the housing and health space was just a belief that both health and healthcare are human rights, not privileges, and that in order to attain health, there are multiple aspects of our life that we need to account for, housing being one of them. A little bit more specifically, when I moved to the Bay Area 5 years ago, I learned about redlining for the first time at the Oakland Museum of California, which if you ever visit the Bay Area is a must-visit museum. They have amazing exhibitions. I'm not getting paid to say this. I just really believe in what they do. And after seeing redlining maps, these things stuck in my head. I couldn't, stop thinking about them every time I read about racial health disparities, or every time I heard someone make an argument that these disparities were rooted in genetics rather than the structure of our society and the flaws that are inherent in our social system. So when it came time to do my research project, I had been involved in some asthma-related research, which is a condition that is pretty disparately spread along racial lines, and decided to look at the overlap between these two questions. Lastly, on a personal level, when I moved to the Bay Area, I had to grapple with issues of homelessness that Angela alluded to. You know, we're faced with these things very acutely in the Bay Area on a daily basis. And I found myself questioning what my role in my greater community would be, both as a professional and as just a resident. And just been thinking about respectful and thoughtful ways which I could bring my skills to help benefit in these fights that have been going on for a long time, much longer than I've been here for. So to cap off this mini autobiography, I guess just really a conviction that housing, in addition to health, is a human right and an integral piece of what is needed to, you know, live a fulfilling life, or a safe life, I should say, and a happy life. So yeah, I'm recommitting myself to this work every day, and I'm happy to be here.
Thank you all for sharing how you kind of ended up in this space. Part of what we wanted to get out of this webinar is kind of setting this foundation of how housing and health are connected. And you've all kind of touched on that with your, you know, how you've gotten into this space. But can you talk a little bit more about your specific work in housing and health and the overlap between those two things? Yeah, Kiana, did you want to go ahead and get started?
Sure. When I think about my work, and you know, Angela hit it on the head when she was talking about social determinants of health. You know, housing where we live is by far one of the components of the definition of social determinants of health, and it really does influence our health behaviors directly or indirectly. And as I mentioned earlier, it's a multi-dimensional determinant. So there are many dimensions to it, and independently and jointly, all of these dimensions also influence health behaviors. In the literature a lot, we see a lot about like substandard housing and how like the condition, the physical aspect of the house affects health. But my work really centers on, my interest is looking at the social aspect of housing. For example, like affordability. We know that it's difficulty paying your housing costs, whether it be rent or mortgage, can lead to housing insecurity. And there can be a ton of health ramifications for that. Those who are housing insecure report poorer health more. They're more likely to experience material hardship. Children are more likely to have developmental or emotional problems. And, you know, just overall being behind on rental payments or worrying about having enough money to pay for your rent is really associated with higher levels of depression and mental distress. So, you know, housing really does, although it's very distal to the health outcome, it really, really does matter, because it's like the center and the foundation kind of it all. And in addition to the affordability, I also kind of look at like where the house sits in context to the neighborhood. You know, one of the key things to a healthy lifestyle is fruits and vegetables. Okay, well, if I'm living in an area that where a healthy retail outlet is not there, then how do I have access to these healthy fruits and vegetables that I've been told that I need to eat? The same thing with physical activity. Can I go outside of my house into an environment where it's safe? So those are kind of the two areas where I see how my work or my interest in my work kind of coincides with how health and housing kind of coincide together.
Yeah, and that kind of makes me think of when you touched on affordability and having healthy fruits and vegetables around. It's like if you're spending so much money on your housing, then you don't even have enough income to spend on these extra things that should be available to everyone.
Yeah, exactly.
And that's compounded a little bit by the fact that, you know, healthcare insurance premiums, if you have health insurance, have been rising. And, you know, I've seen patients and have read about patients who, you know, need to make these really tough decisions between which medication they're going to take. You know, will diabetes kill me before high blood pressure? Which medication can I afford and which medication do I have to stop taking, essentially? And these things are, you know, your healthcare costs are not in a vacuum. They coexist with these other costs associated with housing and affordability of housing. And yeah, I really appreciate your work, Kiana. I'm a big fan.
Thank you.
Yeah, and I think some of the when we started doing research around this and started learning about why Kaiser Permanente should get involved beyond it's the right thing to do, beyond us being having such a large workforce who are struggling. I mean, as a resident struggling to be able to afford housing in the Bay Area, we heard that quite a bit from our residents. Our frontline employees who can't afford to live close to where they work and the long commute hours, the impact that it has on their health. So from a business perspective, it just was something that we needed to think about. But also, we know the research is showing that people who are unhoused or unsafely housed are more likely to use the ED up to 4 times more than other people. So if you're housing unstable or you fall into homelessness, you have greater utilization of healthcare services, and just your continuum of care is just not as strong as it could be as if you were in a stable living environment. And I focus a lot on the homelessness piece because that's the work that we were doing. But people die at least about 3 to 4 times earlier than others who are, if you're homeless or are unstably housed. And so, it's just the data show that the long-term health outcomes of not having access to safe housing, healthy housing, definitely impacts people's longevity in their life and their ability just to function in the day-to-day, as Kiana, as you were alluding to, particularly with the stress and the educational outcomes. But I think what's important too is we can focus on that, but going further upstream, like you started to talk about the balance between paying for rent and paying for housing. When you think of like policy solutions and what can we do to begin to address wealth creation, individual wealth creation, so that people can maintain their housing and not get pushed out from higher rents, and so that communities don't become gentrified. And it's really looking at what are some of the policy solutions around affordable housing, what we need to do to build more housing in our communities, but also the thing that's coming up a lot in the conversations that we're having in terms of is basic income and universal basic income. And I know there was a pilot out in Stockton where they provided people with a basic income and found that some people were concerned about it because they thought they were going to be using it on, things that they really didn't need, not basic needs. So people were buying food and paying their bills and such, just trying to fill that gap so they could maintain their housing. And I think we just need to get really creative around how do we think about providing people the resources they need just to stabilize. Mayor Breed recently just announced providing new moms $1,000 a month, or African American mothers, when you look at the disparity, to maintain their basic income. And some of the work that we've done in Oakland through Keep Open House, which was an initiative where you just had a pool of flexible funding and legal supports to support people who are on the verge of becoming evicted. They learned a great deal through that. We're able to maintain, keep thousands of people in their homes. And we learned that the next phase of that work that we're thinking about doing is a workforce development piece, so that people can build their, have greater employment opportunities, move up a pipeline, hopefully, and get greater wealth creation for individuals so that they can maintain their housing in the Bay Area. So just quite a bit, so moving from health to sort of basic needs, it's like we really need to begin to think about the policies around lending, but also just basic needs that any one of us would want to have, no matter what community that we're living in, so that we can maintain our own health and our family's health. And I think we need to broaden our perspective on what it means to live in a healthy community and who benefits from that. Because those of us who have the power of choice of moving wherever we want to, we won't deny that having a park nearby, the grocery store, whatever is important, but we, as a collective society, we don't feel that everybody has a right to those assets and resources in their own community that will maintain their health. Mm-hmm.
And I think really quickly, just to, definitely confirm and piggyback off of what Angela was saying, if you keep moving upstream to actually look at like the historical policies, the work that Anthony kind of does, as to why, these neighborhoods have this disinvestment due to, the redlining policies from years ago that are still, we still see that effect today, and more modernly through predatory lending. So even getting more creative as we keep going upstream, as we think about, why people, like Angela said, are living where they're living, and not, negating the historical ramifications of housing policies here in this country.
Right, and to piggyback off of what you both just touched on is that not only is this influencing who's homeless and who's marginally housed right now, but also, there are papers, the paper recently published by Jeremy Hoffman at the University of Virginia showed that green space and ambient temperature, there's less green space in places that were previously redlined. Ambient temperatures are hotter. So, and this is a huge issue with climate change, knocking at our door, which many of us are feeling across the country right now. So not only looking forward, not only just looking back to see how our history is currently affecting us, but also trying to come up with, new and innovative ways to tackle these problems, I really think is, a challenge for the future and something that we'll be grappling with moving forwards. And I feel really confident we can, work together to overcome. I think, something else that I think I want to touch on is what the definition of health is. Well, the definition of health that I refer to is the WHO's. They define health as the complete, I'm going to pull it up so I don't butcher it. It's the complete, where is it? There we go. Health is a state of complete physical, emotional, and social well-being, not merely the absence of disease or infirmity. And I think housing touches on all those pieces: physical, emotional, and social well-being. If we as a society can come to the agreement that health is an important, thing that we all have a right to, this is something worth fighting for.
Yeah, definitely. And I think you've all touched on this a little bit, but just getting more into how we can talk about health, how we can keep it in the conversation when we're talking about housing policies. How can we use health outcomes to kind of strengthen housing policies and make sure that they are implemented in a way that promotes health equity? Angela, do you have any initial thoughts on how we can use health as a way to even identify equity issues?
Well, I mean, I think it's kind of where some of the information I provided in terms of the data and health outcome. It's really clear. I think the California Endowment did a study many years ago in terms of the zip code analysis, and people who are living in the flatlands, and you probably have all, are living like 10 to 12 years, fewer years than people who are living in the hills. So the data show, like I said, place matters. The disparate health outcomes in poor communities, low-income communities, communities of color, African American, Latinx, just is very clear. So leveraging the data to help influence policy. So that's critically important. But I also think it's like changing the narrative around all of this, right? I think I think what happened with COVID, right? All of a sudden, all these people lost their jobs with COVID, and people were, oh my goodness, we have to protect their housing. And then people moved immediately to, it wasn't perfect, but immediately to try to put factors in place to get unsheltered people into hotels very quickly, faster than I'd ever seen before, and to put some pieces in place to preserve people's housing. So can we learn from that and recognize that it's a crisis for everybody, not just those who, blaming the individual, I would say, so to speak, particularly in the Bay Area. We had a crisis, we had to respond to it, but we were already in a crisis before COVID hit. And we weren't moving as fast as we would like to make sure that we had enough affordable housing being built. We didn't have the policies in place to educate people that it takes so long through these protracted processes to get affordable housing units built that the price was just exponentially higher year after year after year. It was a disincentive for people to build affordable housing. So a lot of people really didn't understand sort of the factors that were forcing us into this crisis that we found ourselves in. The fact that the Bay Area wasn't building enough housing to match the job growth that was happening in the community. The average person is not aware of that. So they don't really know how to plug in, nor do people know. You take that information to influence, to try to leverage and influence policy. The other piece of it is housing is so jurisdictional. It's like city by city, it's county by county. and some of the work that's happening in the Bay Area through All Home is like, we need to take a regional approach to this and recognize transportation is connected to it, housing affordability is connected to it. How do we bring in the unusual suspects and educate them on what the issues are to begin to weigh in on policy solutions? And it's interesting because if you're familiar with a group called the Bay Area Council, which is a regional group that is some of the major employers in the area that come together around different health and social issues, they picked up homelessness as an issue because they recognized from a business perspective, it was also important for people to maintain affordability in the region. And they actually just today, I saw a note come through that they're actually doing a homelessness news or housing newsletter every so often to kind of raise issues around housing affordability and homelessness. And they've also weighed in on a number of policy issues that could begin to address housing affordability and try to reduce the homelessness population in the community. So I think leveraging the storytelling, leveraging the data, leveraging solutions that work, bringing along your unusual suspects is the way that you need to go about, I think, beginning to influence that broader system level change that we know is going to be the only solution to address housing affordability in most of our communities. I mean, not that the Bay Area was being impacted by housing affordability issues, but this was sort of like, felt like it was the epicenter, because housing is so expensive in California. But that's what I would offer. So it's around health, but it's also reaching beyond that and trying to figure out what's in it for other stakeholders that traditionally aren't engaged in these conversations.
Yeah, I think Angela hit it like really all on the head there. I think for me personally, what I really liked about her suggestions was definitely for me being in the data on the data side and in the health side, just really telling that story and understanding, really delving deep into communities that are marginalized communities that have like housing issues, and really understanding like what's behind why they have the health outcome that they have. There are reasons why they can't make the decisions that they may need to make to do what they need to do to maintain a healthy lifestyle. So really going beyond just numbers and really understanding the story of the individual. And also, Angela, when you were talking about flipping the narrative, and maybe think about, we have to, I guess, come to a consensus that not us on this webinar and panel because we're here because we like housing, but just like housing as a basic human right and as a basic human need. Which combines with, when Anthony was talking about the WHO's health definition, and, we just all have to be on the same page that everyone should be able to have somewhere to live. It's, to me it's simple and how, it's the right thing to do. So we definitely have to understand and help flip that narrative about like housing is important. It's, it's a basic human right and need.
I agree 100%. Just piggybacking a little bit off what both of you just brought up, bringing out the stories of the individuals, I think super important. I think it's also really important to bring out the story of the neighborhood. For instance, I think about West Oakland, which is a place where that was redlined, used to have a thriving Black community that a lot of, from my understanding, was uprooted by the placement of a post office servicing center back in the 60s or 70s. And currently West Oakland is surrounded on three sides by highways. One of those highways is the 580, which goes towards the hills here in the East Bay, and essentially provides the feeder roads to like wealthier, more affluent neighborhoods. And on that road, trucks aren't allowed. But on the other two highways, trucks are allowed on. So you have lots of air pollution. There's a port close by. So thinking about, why these neighborhoods were structured and how these neighborhoods ended up the way they are, I think is really important. And especially when people, politicians particularly, make the argument, we're not responsible for what happened back then. Nobody's alive now that made these policies. The truth is these are still influencing our neighbors. They're still influencing us. And we have a responsibility to change those things. I think that for me, health is the final indicator. It is like the great equalizer in a sense. If there is an inequity happening, health inequity happening, it is just a reflection of a structural flaw in our society, be it in access to, good quality grocery stores. We know that food deserts are a very quantifiable thing that you can find in the literature, or quality education. Or access to healthcare or clean air. These are all things that are influenced by our past and our present. And yeah, I'll end there to avoid rambling. But
Yeah, Anthony.
Oh,
go ahead.
I was going to say, I appreciate you bringing up the education as a driver for long-term health. And we all know that based on where your house is, you have access to quality education or not, right? And I think of, my own story. My mom was a teacher, and we lived on a certain side of town, and I grew up in Tucson, Arizona. So when I think of Oakland, it's nothing like Oakland, but still we were on the poorer side of town. And she knew, because she grew up in a society, in a community where she was educated by her parents, and her parents had, so if I go back, my great-grandparents were owning homes like in the early 1900s. So we had home ownership as a culture in our family. We had education as a culture in our family. And so as a teacher, she knew, and she moved us to a different side of town, which was in a better school district. And she had we weren't rich, we were just getting by. And we actually broke the color barrier in our neighborhood when we moved in. They had a meeting before we moved in because they thought we were going to devalue the homes once we moved in. And my mom still lives there, so when everybody else has moved out. But I think if I didn't have that history and that opportunity, I don't know where I would have ended up. It's an accident I ended up where I ended up doing what I'm doing. And when you talk about human right, it's great, and people need a power of choice. But I don't think that that's a story that nobody else would want for their own family or, their neighbors. And so I think, I don't know, that's why I think it resonates with me so much, is because I watched my own family dynamic and how we benefited so much from the ability to own homes and to be educated, and that definitely has impacted my health and my well-being as an adult, as it has my family. And so it's just I feel like I have that personal journey to share with others about, when you talk about it being a human right and the power and the right to choose. We need to do whatever we can do to provide that opportunity for other people as well. So just being really compelling about that in terms of driving that home, in terms of our solutions and what we can do for one another, just creating that sense of community for one another. So.
Yeah, and kind of going off of that idea of community, and also Anthony talking about neighborhoods, something that we found really interesting was you talked about like the potential impacts that gentrification has on health too in your papers. And you specifically talked about social cohesion also being a factor. So aside from the obvious importance of being housed at all, like being in this neighborhood with social ties and social cohesion, like how do those things play into housing and health as well?
Well, thanks for quizzing me on my papers. Love it. Yeah, I think social cohesion is a huge part of what, builds a sense of community. And the reason community is important in terms of health is that, if you ever took a class in which they talked about Maslow's hierarchy of needs, community is kind of at the top of the pyramid. Housing is kind of at the bottom with shelter and food and water. But having social cohesion produces a sense of community, in a sense that, the people you're living with have your back. And if, you're raising a family, that other people are looking out for your kids, that if something, a tree falls on your house in a storm, that people are going to help out. And that these are things that produce a sense of home. And I think as humans, we use the word home kind of loosely. When people say, oh, I went home, you think they went back to their apartment, their house, whatever. But a sense of home is deeper than that. And this is not really backed by literature. This is just Anthony's belief, but I think that is also an important factor. And when you talk about gentrification and its impacts on social cohesion, obviously gentrification can be a very negative force in terms of social cohesion, and oftentimes is. People moving into a different neighborhood is not necessarily in itself a problem, but if people are not actually invested in those communities and actually invested in becoming a part of the community as opposed to building something different, that's where things get problematic. And actually just was listening to a podcast on a recent vacation called The Nice White Parents by the New York Times, which I think does this really nicely, where they talk about kind of school gentrification in a sense in New York City, and how problematic it is for people to go into communities where they're not from and don't understand the history of a place and the complexities of a community. And so that's social cohesion is important. Gentrification can be a negative influence on social cohesion, and oftentimes is. Does that answer your question?
Yeah, thank you for talking more about that. It's just really interesting to read about. Kiana, can you talk a little bit more about housing discrimination and its impact on health too?
Yeah, so the work that we're doing was looking at, just again going back to that neighborhood work and looking at the neighborhood characteristics or predictors that we kind of looked at to see the risk of housing discrimination, and we kind of found some things that were kind of like not what our hypotheses were thinking. And some of the preliminary findings, we found that higher discrimination cases tend to be non-Hispanic whites, income and home ownership are inversely associated with housing discrimination cases versus it being directly kind of associated with housing discrimination cases. And so discrimination, it's tons of work on discrimination and how that affects health, the mental and emotional aspects of health. So I think it just really goes back to looking at, what those neighborhood characteristics and how that affects, your health. Mm-hmm. Kind of sort of, that's in a nutshell, because the findings are really preliminary. So that's kind of what we kind of see from what we're seeing.
But I also think that, like, when we think about historical housing policy and redlining, I mean, homeownership was created wealth for people, right? That's how you gained income historically, and still do. Think about that, Anthony, when you're talking about gentrification and people moving in and pushing people out. People were coming in here for financial reasons and pushing people out. And so if that the discrimination around the policies preventing people from homeownership and gaining homeownership and gaining that wealth, and just even some of the predatory lending practice that happened in between 2008 and beyond, all those years, and what happened, and who got impacted by that, and who ended up being homeless. When you look at who's homeless in our communities, it's disproportionately African American and African American men, and a lot of their families weren't able to hold on to their homes because they got caught up in these predatory lending situations. And so history seems to be repeating on itself when we think about policies and what's happening. And my concern is that we'll end up there again. We don't know what's going to happen post-COVID. And so it's like, what can we do now, working together to begin to think about solutions to prevent people from getting pushed out of their homes once all these financial incentives are in place to help people maintain their housing. I'm hoping that there's people working together to try to figure out how to prevent more people falling into homelessness, because it's still going to be the Black and brown folks that are falling into homelessness, because those for myself, at least, I'm able to own my own home. I have a job. I can stay housed, but many people can't do that. So I do have concerns about that continued discrimination that will happen and what may not be in place to prevent it from us repeating what happened when that housing crisis happened several years ago.
And I think it also could be, just to go off of that some more, Angela, when you talk about COVID. And I just think about how COVID may also continue these practices and continue to exacerbate this housing discrimination situation that we're seeing in a lot of our, in our cities and counties.
Mm-hmm.
And, you know, people are having to take time off of work because of COVID, lose out on money, especially if you're a wage worker. You know, that puts you in this risk category where you're going to be marginally housed or might not be able to pay rent. And, you know, intersect that with people who have health conditions, you know, who need their blood pressure medications or have seizure disorders and need to pay $300 a month sometimes for medication. So COVID is exacerbating and widening the pre-existing issues that we have here. And even when we made these like landmark policies, like the Community Reinvestment Act and the homeowners, I'm blanking, but the Community Reinvestment Act, like it's this landmark policy, but a lot of the teeth of the policy, the things that would have allowed lawyers or tenants to, you know, sue or press charges against their landlords, you know, were taken out of the bill to protect, you know, the landowning population. And something that when I was brainstorming, you know, what can we do? I think that moving forwards, we really, the goal would be to create intersectional, inclusive coalitions that are composed of people not only who pay property taxes, but people who are also renters and people who actually live in the places. You know, I'm speaking mostly of urban areas where there's a lot of, you know, people are renting a lot of the time or don't own homes, and they don't have as much pulse sometimes at a political level.
Yeah, there's definitely a lot of factors because of COVID. Obviously, the risk of eviction, there's huge health implications from that as well. And also stress is also a big one. But kind of moving into wrapping up a little bit before we get into the Q&A, if each of you could kind of talk about opportunities for partnership that you see between housing and health, maybe within the work that you specifically do or outside of that, also potential barriers to partnership, challenges. If you could provide some insight for everyone, I think that would be really helpful. Angela, if you wanted to start.
Sure. I mean, like I started with, since we started to get into the homelessness and housing realm, Kaiser Permanente has done quite a bit. I'll speak from my company's perspective in terms of developing our investment portfolio, where we're investing in preserving affordable housing. We committed $200 million to an impact investment fund, where we're working with enterprise partners to purchase up units that are in neighborhoods that are on the verge of being gentrified or displaced, and they don't have some of the tax protections that you can to maintain their affordability. So buying up those units and making sure that we can preserve them and make them affordable in the long term. We've done that. I mentioned the partnership we did with a community-based organization to provide flexible resources that are not, you know, tied down by government regulation or whatever, to get people housed very quickly, and that worked. And that organization actually has just received a loan from the Project Home Key to purchase homes in community, which we know is expensive up front, but in the long term is more affordable, and she can maintain those homes as permanently affordable for unsheltered people or people who are at risk of homelessness. And then we've leveraged our financial resources to support the Keep Open House project, as I mentioned, which was helping existing homeowners and preventing them from becoming evicted by providing the legal housing, legal supports, and flexible resources to support them. I think other areas that we're thinking about in terms of partnership are around the analytics and data, and leveraging technology to capture data and information and get people connected to services, and get connected people to resources if they're at risk of eviction. There's that piece, that work that we're continuing to do, the workforce development piece I talked about, And then from a care delivery perspective, one of the things we talked about is being able to capture and understand our member population and patient population that might be at risk of being unhoused or having some housing challenges. We're funding some research right now to try to figure out, to do some predictive analytics, to figure out what can we do from a systems protective perspective to put flags in place to get them connected to services. And so that's what we, from a systems perspective, I think it's important that we look at our own work and what we can do differently to begin to contribute to the solution and share that learning outside of the organization. And I think finally, leveraging the weight of the organization to bring other people along around solutions. I think Bernard did that really well when he was leading the organization, and we continue to do that in a different way. And I think it's incumbent upon us to try to figure out how to continue to do that, so we can create the space as a convener to have different kinds of conversations to identify solutions to preserve affordable housing and to prevent homelessness.
I can go. Two of the things that I think about, and I think about this is more so from the health or the research side and the work that I'm doing. One of the new projects I'm beginning to start is partnering with a pediatric clinic here at Michigan, and they're doing social determinants of health screenings. And, healthcare systems and primary care. And I think that is, you do have to be careful, again, of unintended consequences, as with most things. But I really think that's the way, again, to tap into the story, to tap into the data, the data. And I think, the providers, the healthcare providers do the screening because they're in the clinic, but it's also a great way, I think, for community partners and community organizations to come in, especially the health organizations, to help with referrals. And then not only referrals, but the follow-up process. Like, were we able to get this family or this individual some type of shelter or some type of housing? So that's one of the things that I'm really interested in exploring more. Another one, I think it goes back to, the work that some of the projects that we do here with CBPR. My advisor has this saying that the people closest to the problem are the closest to the solutions. So, tap into community organizations, have everyone, Angela mentioned stakeholders, get everyone kind of at the table: housing, health, urban planners, policymakers, those who work with nursing homes, those who work with children, those who work with people who may have a disability, and, determine the needs of the community together in a systematic way, and figure out how to intervene to address to make the change around the housing needs of the community, but do so, again, without unintended consequences. Or keep in mind as you're thinking about the change to keep unintended consequences at the forefront as well.
Yeah, I really like that. I think everyone kind of in their own space has a different viewpoint of the problem, and they bring that expertise, which is great. Anthony, did you want to talk about potential opportunities for partnership that you might see in the medical space and otherwise?
Sure. Well, I think Angela and Kiana would be great consultants in that field. I think, adding to what they brought up, something in terms of bringing different stakeholders to the table that I've been thinking a lot about recently is how our city planning departments in government are structured, and how they're filled, how these spots are filled. Thinking about how we can give different stakeholders and different parts of our communities actually ownership of pieces of that table, so that everyone can have a say what happens, what is brought into their neighborhood. As from a future healthcare provider perspective, I'd love to be able to prescribe someone housing. I'd love to be able to go to someone in the emergency department who is specifically a housing specialist, and can go through my patient's things that they're dealing with and say, what would be the best fit for this person at this point in time. We often go to social workers at this point in time, but social workers are superheroes. We also ask a lot of them. So that's one thing as a student, that I've thought a lot about. I've had instances where, we see people who are marginally housed or are homeless, experiencing homelessness in the emergency department, and have to, they get discharged, and that's a really empty feeling that you're left with. And it's not about me. I mean, this person doesn't have a place to go. We're sending them back to the streets. So I think, just at a big picture level, that would be ideal. And then just as what Kiana was saying about screening for social determinants of health, I know a lot of providers, and we were taught this in medical school, to ask about where are you staying right now, and just to try to get a sense of the person who's in front of you, and what they're dealing with, and recognize that as physicians, as healthcare providers, we can't solve all of the problems, but we do play a role in sounding the alarm when things are wrong, and bringing in other experts for help. So I guess if you're listening and you're a healthcare provider, I encourage you to do that with your patients. It will not only help them, but help you build a bond with them that is meaningful and healing, hopefully. And yeah, I'll end there.
Thank you all for sharing that. I feel like I'm also learning a lot about how we can bring in different stakeholders into this conversation. Aside from housing and health, there's so many different people that need to be involved. Well, we have a little less than 10 minutes, so I'm going to hand it over to Jacqueline to see if we have any questions from the audience.
Thanks, Amna. Yeah, we have a lot of questions, and I know we're not going to get through them all. One question that I also am very interested in hearing, so I'll ask it first. How is Kaiser measuring success in their housing efforts? So are they measuring health outcomes? Are they measuring ROI? Like, how is success being determined? Angela, you're on mute.
Yeah, that's a great question. I think we're trying to do it in a couple ways. I think with the senior work that we did, the BATS, where we housed the 500 people, we actually we funded UCSF to conduct a study of that population to determine how effective that intervention was. So that study is underway. So we're doing that. I think with the housing of the Housing Investment Fund, and it's challenging just because of the mobility of community. There's part of that work is there's supposed to be a health impact assessment of the individuals that are living in the houses that we help preserve. And so we're working in partnership with enterprise community partners to develop what that looks like, and they're actually executing that. So we'll get some information around that. And in terms of the like our care delivery piece of it, we're just beginning that conversation. And Anthony, I appreciate you talking about the navigation piece, which is so critical. I know Alameda County had put the housing navigators in their ED for a while, and I'm curious to see how that worked. But I think that's what we're trying to do with that, is try to understand what would predict somebody. Could we do anything around predicting factors that might be contributing to someone's housing instability or housing issues, and set up get people, do some predictive, capture that data so we could do some proper interventions with them and getting them connected to referral to resources. And our division of research is looking at that right now. And we're also thinking about, we also do some partnerships with the state about health homes and our Medi-Cal population, and in Sacramento in particular, where we've done some investments and looking at the outcomes from those to see how many people we can get connected to housing, looking at readmission rates, looking at ED utilization of those individuals, and that's something that we want to put in play. So we don't have all the data yet. We have sort of probably processed data, but we do have things in place where we can begin to measure the impact of our success over time. But it'll take a little bit of time because we just are new into this space. We definitely are thinking about it.
That's awesome. Yeah, I think that's a big question for a lot of different health systems and states across the country. Mm-hmm. So a question that I think everyone could answer, that we've gotten in a lot of different ways, worded in a lot of different ways, but this idea of like how to prioritize either improving low opportunity neighborhoods versus moving families into higher opportunity areas. And then I want to put a health spin on that, and like how can we think about health when answering that question on prioritization? I don't know, whoever wants to.
I can go and then I'll stop. And that came up a lot in some of the conversations we had, because there was a debate between whether or not you, if someone's unhoused in the Bay Area, do you move them into, say, Antioch because it's more affordable, and move them out of their community? And people are in different, sides of that coin, where they're like, we want to just get people into healthy and safe housing that's affordable, so we'll do it. And other people are like, well, we want to do what we can to preserve the existing neighborhoods. I don't know if, for me, it's more around what infrastructure exists in the community where you're where you're sending someone. Say you're moving somebody into a new community. If you move people out of the Bay tends to be rich with resources and community-based organizations. But then you move individuals into suburban communities that they don't have that infrastructure, they don't have that support, they get disconnected to family and friends and community that they were living in. And so it's a balance that you have to consider as you're supporting people and finding more affordable housing. And I think that's where the regional piece comes in. When you think about health and community and connectivity, that's why the regional solutions are so important, because you have to, if people are going to be moving out, then you have to be able to work with those jurisdictions to build the community resources that are important to them. And also the way government, the siloed factors of government, like if somebody has resources in Alameda County, those don't easily transfer necessarily to, say, Contra Costa County to follow them. So they have to go through a whole new process to get resources in a new community. So how can you break down those silos to make it easier for them to, the resources to go with them, so to speak, when they move into a new community? So I don't think I answered your question, but I think if people are trying to find solutions to these issues, it's taking that big picture approach of how do you build the infrastructure to support people no matter where they live.
Yeah, and on that note, Kiana brought up the CBPR, community-based participatory research, and how asking people close to the problem, oftentimes, they're also closest to the solution. I struggle with this question because I think I'd want to just ask the people who, are marginally housed, where do you want? Like, obviously, I understand it's more complex than that, but I think that, people know what's best for them. If you were to ask a universal basic income expert, they would just say, give everyone money because everyone knows what they need best. And I kind of feel like the same applies here.
My only addition would be to what Anthony and Angela mentioned. Angela talked about the infrastructure, but also balancing that social cohesion network that we talked about, and Anthony talked about earlier as well. When I think about children and adolescents and what I'm learning with that population, you just don't want to just up and disrupt their neighborhood, because what our perception of what may be safe may not be what their perception of safety is, or their social network. So I think it's really important that as we balance the infrastructure, that we also remember to do so socially as well, and get that information as well.
Absolutely. I love all those answers. Definitely a very, very complex question, and there's definitely no right or wrong. Or we need that holistic approach, right? So we are about 2 minutes away from the top of the hour. Are there any final remarks or things that we wanted to touch on? And if not, I'll pass it to Amna to close us out.
All right, thanks, Jacqueline. I just want to say thank you so much to our panelists, Kiana, Angela, and Anthony. I really enjoyed the conversation and all of the topics that you all brought up and were able to expand on. So thank you for sharing your expertise with all of us. I hope that the audience members who are listening, hope that you learn more about the connection between housing and health and the importance of different sectors working together to improve housing policy and making sure that it's taking these different factors into account with housing policy advocacy and trying to address health equity issues. If what you heard today resonates with you at all, we hope that and encourage you to become a member at yimbyAction.org/join. They have a lot of different membership levels, and at any levels, the membership supports this movement and makes sure that we can fight for abundant housing and better health outcomes that come with housing stability. So thank you all for joining us, and we hope you have a good rest of your evening.
Thank you.
Thank you, guys.